In 2026, Social Security goes up by about $56 a month. But Medicare Part B jumps to over $200 a month. That's why the real increase most retirees feel is closer to $38. Here are the official CMS numbers. The standard Part B premium goes up from $185 to $202.90, and the deductible jumps from $257 to $283 in 2026. Stick around, because at the end, I'll show you what most retirement planning gets wrong and how people quietly reduce this hit. Section 1. The 2026 Squeeze. So let's just get right to the heart of it. We're calling this the 2026 Money Squeeze. And honestly, this is the main thing that's going to affect millions of retirees across the country next year. And wow, this chart really tells you everything you need to know in one quick look. See that bar on the left? That's your Social Security Cost of Living Adjustment, the COLA, coming in at 2.8%. Now look at the one on the right. That's the Medicare Part B premium increase, a whopping 9.7%. So yeah, healthcare costs are rising more than 3 times faster than your benefits. That, right there, is the squeeze in a nutshell. Section 2. Social Security Raise. Okay, let's break this down piece by piece. First up, the good news. Let's talk about that raise you're getting in your Social Security check. So the official number for the 2026 Social Security COLA is 2.8%. Now, this adjustment is supposed to be tied to inflation, right? The whole idea is to help your benefits keep up with the rising cost of, well, everything. 2.8%. But what does that actually look like in your wallet? Well, according to the Social Security Administration, for the average retiree, that works out to about an extra $56 a month. So, the average payment goes from roughly $2,015 up to $2,071. Section 3. Medicare's bigger bill. But, and this is a big but, that's only half the story. So, where is that $56 actually going? Well, for most people, a huge piece of it is going right back out the door to cover those climbing Medicare costs. The first big bite out of your raise. The standard monthly premium for Medicare Part B is going up by $17.90. And since that usually comes straight out of your Social Security check before you even see it, that $56 raise just shrank to about $38. Just like that. This really gets to the heart of the problem. There's a quote from Todd Wallace, an expert with the National Social Security Advisor Group, that just nails it. He says, "The story of 2026 is simple. Medicare is getting more expensive and Social Security isn't keeping up. And the thing is, this isn't just a 2026 problem, it's a trend, and it's something you have to factor into your long-term planning." All right, let's get into the nitty-gritty. These are the official numbers from the Centers for Medicare and Medicaid Services. Standard monthly premium for Part B, it's jumping up to almost $203. Annual deductible, the amount you have to pay out of pocket before your coverage really starts, that's going up by $26 too. And it's not just Part B, unfortunately. The costs for hospital stays under Part A are climbing too. The deductible for a hospital stay is up by $60. And if, heaven forbid, you have a longer stay or need skilled nursing care, those daily payments are ticking up as well. Each one on its own might not sound like a disaster, but boy, they can add up to a huge bill if you have a real health issue. Section 4. High Income Surcharge. Okay, now we need to talk about something really important that affects about 8% of you out there. For this group, the costs are going to be even higher. We're talking about a hidden surcharge that can be a really, really nasty surprise if you don't see it coming. So this brings up a really direct question you should probably ask yourself. Am I going to have to pay more for my Medicare just because of my income? And you know what? For more and more retirees, the answer is, unfortunately, yes. It's all because of something called IRMAA, Income-Related Monthly Adjustment Amount. It's basically an extra fee that folks with higher incomes have to pay for Medicare Part B and Part D. But here's the part that trips everyone up, the most crucial detail. It's always based on your income from 2 years ago. So, your 2026 premiums are being set right now by what you earned back in 2024. And just look at how this plays out. It's what people call a cliff. It's kind of crazy. If your income as an individual back in 2024 was, say, $109,000, you're fine. You pay the standard premium. But if you made just one single dollar more than that, boom, your monthly premium suddenly jumps by over $81. It's a massive penalty for crossing that line, and it catches so many people completely off guard. Section 5. How to take control. Okay, So that's the problem, right? It's a little daunting, but let's not just dwell on the problem. Let's pivot to the solution. Let's talk strategy and what you can do to take back some control and manage these costs. So, the first question on everyone's mind who gets hit with this surcharge is, can I fight this? Can I appeal it? And the answer is absolutely yes. But you have to have a qualifying reason. The Social Security Administration has this list of what they call life-changing events. If you've had one of these, they'll take another look at your IRMAA surcharge. The biggest one, by far, is retirement or cutting back on work. Think about it. If your income has dropped way down since 2024 because you stopped working, you've got a fantastic case for an appeal. Other things that count are stuff like getting married, divorce, or sadly, the death of a spouse. And you know what? The process to appeal is actually pretty straightforward. There's a form called the SSA 44. That's your official request. You just need to gather up some proof of what happened. Like a letter from your old job saying you retired. Then you just send it all in to your local Social Security office. Believe me, if you qualify, it is 100% worth the time to do this. But, even better than appealing a surcharge is avoiding it in the first place. This is all about proactive, smart planning. It means being really careful about managing your income. For example, instead of doing a huge Roth conversion all in one year, maybe spread it out. Or, if you're over 70.5 and you give to charity, look into something called a Qualified Charitable Distribution, or QCD, from your IRA. It's a great way to lower your official income. And of course, something everyone should do, no matter your income, is review your Part D drug plan every single year. It can save you a fortune. Conclusion. So, there you have it. We've looked at the numbers, we've defined the squeeze, and we've walked through some real strategies you can use. But all of this points to a much bigger challenge for anyone planning for or living in retirement today. We know healthcare costs are going to keep rising faster than our benefits. It's predictable. So, is your retirement plan really, truly ready to handle that gap?